We do have seniors in our community that live at home still that are in their 90s, that are, going up in age. And some of them are in their 80s that live alone and take care of themselves. So we need to offer services that's going to make that easier for them, whether it be Meals on Wheels, so we know they're getting at least one healthy meal a week, or the visits that I can go and do with them, or having them come to do activities with us just to kind of break some of their isolation. That means the world to the seniors. For those seniors, it might be the only time that they get to talk to someone. A visit that could take, maybe 2 minutes to do an exchange, but those volunteers take that time just to have a little conversation with those seniors, which to them is the world. It may seem simple or small to us, but if we didn't have those volunteers, we wouldn't have the seniors see anybody sometimes.
I would say the seniors are really appreciative of any type of activity that you offer, whether it's you're teaching them something about their own health or wellness, or if you're doing a social activity. They just seem to be grateful that there's people coming and providing that service. So you feel very valued as an employee or as a volunteer when you work with seniors. There's already a very strong sense of community here. So that's something that I didn't need to work to create. In other parts of Quebec, I'm sure that the organizations have to work harder for that, because perhaps their Anglophones aren't all within, several kilometer radius.
Our goal really is to do everything we can to keep our seniors as healthy and autonomous as possible so they can stay home as long as possible. But what we try to do is make sure that these people that are living alone or who may be experiencing isolation a bit more than others, is that we try to get them out, get them connected to our services. Our outreach worker goes to visit them. I believe that we're an essential resource for the English-speaking community and a critical part of the ecosystem. Without us, I don't think that the community would have as much access to services as what they do have, because not only are we creating links, we mobilize the community, but we're also mobilizing partners. So we only make up 5% of the total population, around 675 people. So often we're not a natural reflex for the majority. So it's essential for us to be there reminding them, you have an English community, these are the particularities of that community, these are the needs that they have, the services they require. So I think without us there doing that work, I'm not sure the level of services and the support to the community would be the same.
We have a good partnership with CAMI. They are on the field with the community, so they could be our eyes or our ears to help us answer the needs of the community. They're here to give us information and to ask people of Grosse Ile what they want and what they need and how we can help them. And CAMI is a good partner for us to help with this.
CAMI officially started as a nonprofit in 1987. The creation of these nonprofit organizations for English speakers was largely due to the political environment at that time. Bill 101 and the political pressure that the government had put on the English-speaking community at that time. So the original mission was to promote and protect the rights of Anglophone Magdalen Islanders. And over the years, we've evolved to become more of a community development organization to support, develop, sustain the community, and we focus a lot on collaborations and partnerships with the majority community. I think that's been one of our key successes over the years, especially the last 10 years, is how we've developed sustainable relationships with the Francophone majority, and we've built a lot of bridges and we put a lot of effort in that because we don't want to create parallel services. We want to work with what already exists and help support partners to be able to do what they do in English. The community here is very tight-knit. If somebody's sick, everybody's going to be doing what they can to help out. So when you need help, the community comes together to help one another. You know, we're small, we're all together. Everybody really knows everybody. So like I said, even if you're not blood family, you still feel like family because you've known these people all your life. You've either went to school with them, you've known their daughters, their sons, their nieces, their nephews.
I'm hoping with all the work that I do with CAMI that my community realizes that we're here for them, the same as my colleagues, the different things that they do in their jobs for the community, whether it be 0 to 5 or our seniors, our youth, wherever. We all try to do what we can to make sure that our community knows we're there for them.
I really enjoy what I do. I'm driven by my passion for the community, and I'm driven by the feeling of service. You know, I feel like when I go home every day, I'm doing something purposeful. You know, when you see the smiles on the senior's face, or when you know you've helped a family out, or no, it's really rewarding, and it's really a great feeling to be able to work and support and give to your community.